we'll also talk about some topics of along the lines of reproductive health and just get into a good conversation. There's questions that we all want to know. And our goal is to have a good conversation, a frank conversation. And if you all have any questions, just drop them in the comments and we'll try to get them answered. So, good evening, Dr. Campbell. How are you?
I'm doing perfect. Thank you very much. Thank you so much for inviting me to be on your show this evening.
No problem. We're glad you're here. Do you just want to provide a little bit of your background and let folks know what brought you to your career?
So my name is Rwanda Campbell, as you stated. I'm an obstetrician gynecologist. I have been an OBGYN, gosh, I say since for 24 years now. I chose OBGYN primarily to empower women. When I meet women in my office or at the hospital, it's mainly to empower them, meaning that to gain knowledge with them, to allow them to be entrusted into my care. Most important, I really do this every day, really to empower women. Because I think the more knowledge women know about themselves and about their bodies, just the better person they can be. They can be the better person for themselves, for their families, as a wife, as a mom. And so I think if she knows about herself and is empowered about herself, then she in turn can be the best that she can be for herself and her community.
Right on. And so when you're talking about being empowered about ourselves, what does that mean? I think for some women that's easy to be in tune with your body, to pay attention with how you're feeling during your cycle, giving yourself breast exams. But there's some women who aren't necessarily there and for various reasons. So what does that look like? What does that conversation sound like?
So that an empowerment conversation usually is when I meet a patient for the first time, she comes, you say just for her annual exam. And I ask her just basic questions of her medical history. A lot of times I ask her, where are you? Where are you in your life? Are you, sometimes women, because usually, because we are so busy taking care of, our children and our husband, that we sometimes forget about ourselves. And so sometimes women come to me and they only come in because I've had this pain now for years. I've had this bleeding now for years. And then you realize, gosh, she's been so busy taking care of someone else. Why has she not been able to take care of herself? And so it's kind of refocusing and letting her know, you know what? If you feel better, you can be a better person to yourself.
Mm-hmm.
You can be a better wife to your husband or to your partner, and you can be a better mom to your children. So you
Right.
just kind of refocus them back into it's really okay, really, to care for yourself so that
Mm-hmm.
you in turn can be better for others as well.
Right on. Have you heard what are some of the concerns that you're hearing in relation to the whole COVID-19 pandemic?
So usually for women, especially pregnant women, it's just like, oh my goodness, can I get COVID 19 because I'm pregnant? Was my baby? Can I pass it on to my baby? Those are the concerns. Oh gosh, is the hospital safe for me to have my baby at? Should I just have a home birth instead? So then we just kind of have to step back, and again, it becomes an education of the woman. Like most importantly, let her know, hey, COVID is a virus. We don't really know how it's transmitted, but we do know some simple things that you can do. No different things we're saying patients now to stay at home as much as you can, or even things like don't be around anyone that's sick, or making sure you're doing proper hand washing. And I also know that when you do come to the doctor's office now, or if you do come to the hospital, there are certain things that we're doing to ensure your safety. Most importantly, we're asking people, asking the screening them, do you have a fever? Do you have a new cough? Do you have any shortness of breath? And then we're taking their temperature. Even before they even come to the door of the hospital to the clinic now, we're making sure that those who have any of those symptoms if they say yes in those questions, they go someplace else, whether it's a patient or even a healthcare worker. So that way, so that those who at least come into the hospital more than likely are, do not have the virus. Or if they are at risk, those patients are being cared for somewhere else, in the facility.
Right on. And also too, so must a fever be present to have COVID? Like is it all of those things, or can you?
That is our challenge now.
Mhm.
We are learning each day that there are other symptoms that may be associated with having COVID. So no, it necessarily not necessarily does not it's not a fever. But I think our challenge is now, because as you hear on the news all the time, this whole testing thing, is our biggest challenge now. Is that if we were able to test everyone, then we would know without a doubt, who has COVID, does not have COVID. We only now, right now, only doing it if patients have certain symptoms.
Sure.
So I think for us, that's one reason why, because you don't necessarily have to have a fever to have COVID. That's why we're doing things to prevent. We're saying things like, now we're asking people, well, when you go out, to wear a cloth mask, because if you have COVID and you don't have a fever, but if you have it, then if you have your cloth mask, then you decrease likelihood that you can transmit onto someone else.
Right on.
And that's why we as healthcare workers inside the clinic or the hospital, that's why we're doing things like you will see us washing our hands, before we talk. You will see us wearing a mask in the house. You will see us wearing goggles, so that you too can know if you're there, that we are doing everything that we can to keep you safe and not have that transmission or reduce that transmission between, our healthcare provider and their patient.
Right. What about women who are experiencing discomfort or just being burdened by a severe case of fibroids or these other issues that we find ourselves trying to manage? How is that managed now?
So a lot of that really depends on the clinic where you care or where you give care. So some clinics now are doing primarily, telehealth visits where you can talk to your provider via the telephone, whether it's video like you and I are on right now, or telephone, or which is happening now. Some clinics actually now too are allowing patients to come in for an appointment. So a lot of that really depends on, for the patient, their degree of comfort. They want to be cared for, via telehealth or cared for via in the clinic. Because now, even if they come to the clinic, we are still doing those things about making sure that those who come in more likely are those who do not. And if they do have symptoms, those patients are cared for someplace else in the facility. So we kind of have a sick side and not sick side, kind of the hospital of the clinics now, as opposed for patient safety. So, but if someone, so you probably have read about that at one time we were not doing any elective procedures because of the whole COVID thing. But certainly now what is happening, since we have done such a good job, we are now being allowed as surgeons now to maybe do some surgeries now that we weren't able to do before, but we kind of have to justify it though. Gosh, my patient, she has really bad pain from her fibroids. She can't work. She's in the ear all the time, or she's bleeding all the time, needs a blood transfusion. That patient is put a little further to the list as opposed to someone's like, oh, I'm having a little bit of discomfort, I'm okay. But a lot of this really comes down to your communicating with your gynecologist about what's going on and how we can best manage you. How can we, again, empower you with making decisions and stuff?
Right on, right on. Brittany, jump in if you have any questions.
Yes, absolutely. So I know some people, maybe they're not able to get the care that they would hope for by their OBGYN given the pandemic, or maybe they just don't feel comfortable going in right now because of the virus still spreading and the shelter in place order still being enacted. So I wanted to know, as an OBGYN, what are your thoughts on some of the kind of DIY healthcare trends that are happening that some people may be practicing in lieu of going into a doctor right now? So things like yoni steams and yoni pearls or the eggs, like, are those things recommended by an OBGYN? Can those things alleviate, symptoms related to your cycle or fibroids or things like that? What are your thoughts on those?
So this is my bias. Certainly as an American trained obstetrician gynecologist who went to U.S. medical schools, trained in the U.S. residency program and certified the American Board of OBGYN, there are certain things that we were trained to do. This, based on science. You learn again about this whole pandemic. What does the science say? What do the studies say? Now, I am agreeable though. There is a degree of holistic approach, that holistic approaches that are out there that kind of work for patients. And so I say it now, I'm probably a little bit more, at least we'll listen to the conversation, about patients who can find alternative options, so really, in a lot of patients who are, say, probably are very in tune to their bodies. And so they may say things like, oh, Dr. Campbell, I find like if I change my diet, if I do some exercise, if I do aromatherapy, if I do things like acupuncture, those things may help. So there are certain things, there are certain vitamin things that may not hurt anyone, but they quote quote help, but it could be also placebo as well.
Yeah.
Then it really kind of comes down to just where is someone mentally. I mean, I am a spiritual person, I certainly believe that if you just kind of tune in and whether what your belief system is, that a lot of things can be taken care of that way. And so I would not at all have to get, if a patient came to me and said, oh, I'm trying this, I'm trying that, I said, well, is it working for you? Okay. But there are a lot of things that when patients come talk to me, I say, well, certain, like I would say some supplements that are out on the market, those type of things for some, if they work for them, then I'm like fine. But if they come to me and there are certain things that are probably not safe, then I say, gosh, it's probably not the safest thing. But there are a lot of things out there that patients are purchasing, are paying their money for, the insurance companies are not paying for, that are working just because placebo, more so than, gosh, this one thing works and everything.
Got it. So in the reality that is COVID-19, we are sheltering in place, and a lot of people are spending lots of extra time with their significant others. So sociologists are predicting that there will be a whole new wave of babies that come out of this, or that babies will be conceived. So for new parents or families who are looking to expand, is there anything that can be done? Maybe people aren't able to see their OBGYNs and get checked up for their annuals right now and things of that nature. For people who are looking to grow and expand their families in this moment, aside from just practicing itself, what can people be doing to help the conception process?
Well, I think again, I think for what as all women, I think it like all things becomes a family decision. So we quite don't even know right now. So today's April 30th, 2020. We could have a reunion for us, this show, in a year and see where are we, with COVID-19, and to see where we are. So I really don't think we know, honestly. And so I think it really comes down to a family decision, an empowerment decision with the family. Say, gosh, we want to have a baby now and have a baby later. Again, that's where we are. Now, we do know that, the COVID-19 virus is just primarily transmitted via respiratory droplets. So it's not, so it's not one of those things like, it's not, transmitted via semen. It's not, so it's not an STI, anything like that. Right. It's via the respiratory droplets. And so we also don't really right now have any known cases of it being transmitted from a mom to a baby in utero. Because of just how the transmission is. But that's today, we're here today, it could be something different. But right now, we think it's primarily via the respiratory droplets for how the virus is transmitted. And so that being aside, so if a couple decides, hey, we want to try to have a baby, then those same things that most couples do to try to figure out, like when am I ovulating, and when do we want to do this and everything. So we're certainly not recommending that people not get pregnant as far as it goes. But I will tell you too, if a patient needs to be seen, I think I'm pregnant, whatever, then like I said, we can have a discussion via telehealth. But also patients, we're still performing ultrasounds on patients who need to have the ultrasounds performed. I think it's just an issue of you calling your provider and saying, hey, how are you all seeing patients? And so when we still are doing things like their first trimester ultrasound, make sure that we can date the pregnancy. We're still offering women genetic counseling, as far as, and they're still getting some care. The majority of their care is being done. Women are still getting that ultrasound done at week 20. Or if we find someone that has a high risk pregnancy, we are still seeing those women. I work now as an OB hospitalist in St. Cloud, and we have a whole cadre of high risk OB patients, who have announced their pregnancy. We're still seeing twice a week, but we're doing those things, as we're saying, to keep the patients safe and to keep the staff safe. That's right. So even though it feels like, gosh, there's nothing going on in the hospital, in the role of obstetrics, it is just, like I said, these babies know nothing about COVID-19, the ones that are in here right now. So they're still doing their thing. They're still coming. They're still having their issues, and we're still caring for them.
That's exactly the question that I was going to ask. So I was considered high risk of having my first child at advanced maternal age of 40. And so then, yes, at 8 weeks, I did the genetic testing.
Yes.
And we learned that we were having a boy.
Yes.
And once I was further along, I was going once a week to see
Yes.
Provider? So that is a good question. So Zolf's, and what are the precautions that that our patients are asked to take? I mean, masks, gloves, what does that process look like?
So we are, so, you know, as I said, so most clinics and most hospitals, before you, people who come past the door, again, we take their temperature now, and we ask those simple screening questions, things like, you know, any fever, any new cough, any shortness of breath. So if those patients say no, 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 then they're able to come into the facility, you know, and have their appointment done. And then each, as a healthcare worker, those 4 questions are asked to me each day as when I walk through my door as well. And I get a sticker to clear me and say, yep, you know, I passed the screening process. And then when we're there at work, we too are wearing masks. We are wearing eye goggles. And then we only use gloves if we actually are touching the patient. So we're not necessarily recommending that people wear our patients wearing gloves, you know, inside the hospital, because you have to, so special way of putting gloves on, taking gloves off as far as it goes. And then we do ample hand washing. I just make a habit of, if I care for a patient, she sees me washing my hands and before I touch her, examine her. And then she also, when I'm done, she sees me examine and wash my hands as well. So just to know that, gosh, my doctor, my provider is making sure that, you know, that I stay safe and she stays safe.
Right. So there's no requirement for the patient to wear a mask yet.
Well, no, patients can wear, but right, in our facility, yes, when they come in, we do give the patients a mask.
Okay.
Whether it's our mask or if they come in with their cloth mask,
okay,
as far as it goes, yes. Thank you for clarification.
Right. One of the issues that, and I think Brittany can set this question up, is the issue of abortion.
Mm-hmm.
What, Brittany, if you want to jump in, I know I'd forwarded an article about that.
Yeah. Yeah, so you know, there's a lot of information and conversation that's actually happening today, specifically around abortion, because so many clinics are losing their funding right now. And so there's a question of, especially as we see, you know, motions being passed at the federal level that are kind of trickling down to the rest of the country. Will abortions be accessible moving forward in the pandemic, or if these clinics and other institutions start to close, will they lose their funding? What is happening as it relates to abortions, and how are things shifting in terms of accessibility in this moment?
So I think that is really a challenge. I mean, really a risk putting at women. And so certainly me as an individual, regardless of how I may, because I personally do not perform the procedure, but I certainly though believe that it certainly is a woman's choice. And so usually if a patient comes to me and has that question, then I'm usually able to refer to a provider, one of my colleagues who I know who does perform that procedure. But there are also too, though, there is also an option now which always has been out also for, if we're in the first trimester, i.e. less than 12 weeks, that women can have the procedure done medically, you know, in which they're given 2 pills to take. But one pill that can only be prescribed or gotten by a certain, probably an abortion clinic, versus the other pill, it works better with the 2 pills. So I think something we're going to have to do to advocate, we're going to advocate for ourselves, whether it's, you know, calling a congressman or a congresswoman and advocating and saying, gosh, this has to be done. And I think, unfortunately, it's the nature of our country right now, to where we are limiting the choices of women. That can only be, as I was saying, not optimal for women. And I'm saddened that the clinics are not being funded or have the risk of not being funded. It's a sad state. It really is. And so I'm hoping, because there's also a discussion about that maybe we can, you know, the notion of sometimes, you know, as far as the options are, that women can maybe in some situations can just call, and if they desire the medical procedure, those meds can be just ordered for them. They can pick them up and have their abortion in the safety and comfort of their home. That's only if there are certain weeks, you know what I mean? Not just, you know, less than 12 weeks where the medical abortion is an option, versus having the procedure done. So I think it's something that we just have to advocate for, and try to advocate that women is part of our equality, part of our empowerment to have that choice.
Mm-hmm. Yeah, now speaking on choices that women have, the founding father of modern gynecology, James Marion Sims, he developed all of these studies and these tools that are used today, but unfortunately, he did it at the expense of enslaved women who were of African descent. And so I think for some people who are aware of that history, there is a stigma around going to the doctor and going to see an OBGYN. But as you started this interview with, when you aren't taking care of yourself, you know, and fully aware of your own body, and it's not an intuitive practice, you're not able to be as great to your kids or your partner or anyone else, not to mention any pain you may be feeling. So to anyone who's viewing who may have a skewed view of modern medicine, of gynecology, what can you say to affirm them or empower them that this really is something that they should be taking seriously in terms of like getting checked up annually and finding a doctor who they can trust?
That's great. I mean, that is such a great question, Brittany. And I think a lot of it really is, since we have such a wide network now, no one really is alone now. So in my business, and probably in your business as well, you get a lot of referrals. So I would have women that say, you know what, call up your girlfriend, call up someone, call up your church, call up your sorority and ask, like, hey, who do you see? And so there's probably someone within your circle. They may say, oh, I see Dr. X or I see Dr. Z. And there's so many providers, male and female, who I think who do this and empower women. So for that woman, I would say, talk to someone else, someone that you trust, someone that you believe in, and who does she see, or who does her mother, or who does her daughter see, and maybe have that to be an entree way. And sometimes what happens is that I've situations where I've taken care of, say, the mother. And then the mother say, oh, what about my daughter? Oh, about my mom. And sometimes you find yourself taking care of a cohort of family women, the females, whether it's the mother, the grandmother, and the daughter. And then they'll say, oh, do you know my cousin? And so then that ends up helping as well. So I would have really women, there are women in your world, in your life that you entrust. And so seek out and reach out to them. And if they don't know, then there's someone else that they do know that can direct you to someone that you can trust.
Absolutely.
Awesome.
So, pardon me, we're hearing a lot about going back to normal when this is over. Will we be back to normal? Is going back to normal necessarily a good thing? And what will be some of those changes that we will see when it comes to reproductive health?
So I think we have to look forward, and it's going to be a new normal. So I was so interested that you're saying it, because as I was driving home today, I was listening to like one of my I listen to podcasts when I'm driving, talking about the whole new normal, and realize, what we thought was normal before is not going to be the same. So the quicker I think all of us get to that, I think the better we'll be able to move forward through this process. So I always think about, when you think about like driving, because I do a lot of driving with my job now. Think about, I'm driving in my car. I have a very small rear view mirror, but I have this whole big front mirror. So the rear view mirror is very small, and the more time you spend looking behind it, things get smaller as you move forward, versus as you move forward, things are bigger. So I think our normal is the new normal. So for reproductive health, what does that mean? I think, again, for women, that means that now some women may have better access to us as OBGYNs via telehealth as an option, and also via coming into our offices. And so now for some women who say, gosh, I'm just so busy, or I can't do this, I just need someone to talk to, then I'll have some of my colleagues will have part of their days blocked off just to do telehealth visits. Or those visits can now be in the evenings, and so a little bit more where, as a woman trying to manage her career, gosh, she could come home in the evenings, get her babies to bed. And then she now says, for the next 2 hours now, I'm going to do telehealth, talking to my patients, who now have some questions answered. Gosh, when should we start a family? So we can have those discussions. So I think this is an opportunity to offer us where we may be able to impact and empower women. And so, Brittany, as you were saying, the women who are afraid about coming to our office to see us, maybe she meets us now via telehealth. You know what? She's okay. Kind of like an interview. I think I'll go in and see her. So therefore, I've not violated her. We've not risk violating that person physically, because now they've had an opportunity to screen us and say, you know what, pretty good conversation. Now I think I will go in and have my exam with him or her. So I think, so I think moving forward, I think women are going to have, again, be much more empowered because now they have choices. Do I have to go in and see the doctor? I don't have to. Let me go and talk to him or her first. And then if my pain is that bad or if he has something done, then I will go in and see him or her. So I think we just, as for all of us, this is my oldest told me, he said, Mom, you know what? The great adapt. I said, you know what? Like, okay, this is my child saying this. Okay, all right. The great adapt. So those of us who are not great, we want to adapt, and where we'll be in the rearview mirror, getting kind of like lost, versus us moving forward with the big front window. We are adapting and moving on. So I think the new normal for us is women are just going to have more opportunities to interact with us as their providers and their care providers. And they're going to be able to gain more information from us so they too can be empowered, so they can make some empowered decisions.
Right on. And Dr. Campbell, thank you for your service, for saying that now, for being on the front line. And how are you doing? I'm hearing these questions that people are being asked. How are you doing? How are you managing the weight?
So I am doing fine. I spend a lot of my time before work and doing work and after work. I mean, as far as saying prayed up. You know what I mean? I am a Psalms 23 and a Psalms 91 person that I kind of meditate on as I'm going to work and as I'm there. And I just feel like, that this is my mission. This is part of my calling, being gifted to be able to be an obstetrician gynecologist. So I just pray that while I'm there, that I'm being protected and that I'm being cared for, and that I'm at the same time I'm going to do the things that I know to stay safe, everything. But just believe that as I trudge forward through this, that we are being a part of a family's history. So I feel honored to be able to care for women, and help them bring their babies into the world and be part of their family history. So it's a mutual admiration for those women who choose to come into the hospital and have their babies. And so doggone it, we're going to do everything we can to make sure that they have a very positive and safe experience in the hospital.
Wonderful. And then when you get home, how is your family responding? Are they like super worried, or have you all just settled into a routine of?
Well, we have a ritual that, that when I come home, it's kind of like, Mom, well, first, I guess I'll just be honest. So first off, when I leave work, I leave my work clothes at work, you know what I mean? And then when I come in, I usually, leave my shoes outside. And I come in, I shower and do everything before I even interact with my family, as far as it goes. And just so that I know that Mom's doing the things, to keep us safe and everything. And so just like all of us doing at home, we're all cleaning, we're all make sure to wash our hands. You have your Germ-X throughout the house, you have the paper towels out the house, and no one gets offended if you say, hey, did you wash your hands? And so as a family, if I tell you to wash your hands, you're not going to be upset. You're not going to roll your eyes. You're just going to say, okay, you're going to go wash your hands. Even if you just did it, we're going to wash your hands. So for us to have that open dialogue, that we're all trying to keep each other safe and everything.
I love it. Yeah, my last question was, in this moment, a lot of us are just going to be home for a while. Is there anything that we can be doing to ensure we're maintaining our reproductive health in this moment?
Yeah, I think as we all do. I mean, things I would say, making sure that we're eating healthy. I think at the beginning of this process, we all were like grabbing the carbs. It's like, oh my gosh, when is this going to end soon? Now we realize, oh, this is going to go on for a while. So let me refocus here. Because I even thought like, oh my gosh, I can't, eat health or diet during the pandemic. I need to be healthy. But I realized, this is going to go on for a while. So you need to step back again, just like I'm telling my patients, what are you putting inside of your body? Are you eating healthy? So what can you do now? You have time now to prepare meals. You have time now to meal plan, and you have time to cook. So you should be cooking and doing healthier things for you and for your family. And the biggest challenge is the whole issue with exercise. Whether it's now, unfortunately, the weather here is better. So maybe you may want to be able to get outside and do walking or running, or if you're inside. I guess it looks like everyone now has a Zoom or online, dance class. I haven't gotten there yet, but I am thinking about doing the meditation or the yoga. do physically, and then mentally too. Where are you mentally? So are you choosing just to meditate? Do you have a faith that you believe in, something you can kind of center your day and kind of start your day? At the end of the day, gosh, what am I thankful for? So those are kind of the kind of like the physical, mental, and spiritual part, that you're doing everything. And just like you said too, as an opportunity to reach out and to share what you're experiencing and just share with others as well.
Wonderful. Well, Dr. Campbell, we really appreciate you, your wisdom, your insight, and we certainly hope that you will come back and talk with us again. And maybe we can even open up the conversation and have a couple of our friends, Brittany, join us and have
that would be great.
Yeah, round table.
Yes.
Because this is such an important question, and that really speaks to that piece of easing that discomfort of having these conversations about reproductive health. So I can't express enough our gratitude, and stay healthy and stay safe. And we will see you again. And Brittany, thank you so much.
Thank you.
You bring it. And so thank you for working with us. And I really hope that everybody has a beautiful weekend, and stays healthy.
Yes.
And continue to follow us online and our Facebook page. And we will be talking to everybody soon. And also I want to give a special thanks to Kelvin Curia, our young tech guy, our producer who helps us with these. Thank you, Kelvin. We appreciate you too.
Yes.
Thank you, ladies. It was a joy to be here. Thank you for welcoming on, and I would love to come back. I love to chat. I love to chat and empower women. So that's whether I'm in the hospital or in the office or here on Zoom with you all. So thank you.
Thank you.
Thank you.
All right. Bye.